everyone, welcome you all to my channel. In today's video, I will be explaining indicator of maternal and child health care. These indicators are super useful, especially if you are a medical or public health student preparing for exams or just trying to understand medical, maternal and child health care better. So let's get started and go through each point one by one. First is the indicator of development and healthcare. So timeline, gestation, that is 28-week gestation is the period from conception to delivery. So 28 weeks, then day 0, then day 7, day 28, 1 year and 5 year. So from 28 weeks to day 0, that is birth of a child. In this period, when child is died intrauterine due to intrauterine causes inside uterus, it's called a stillbirth. And when we give birth to a baby, it was already died, so it's a stillbirth. Then from 28 weeks of gestation to the day 7 is the perinatal. From day 0 to day 28, like after birth, day 28 is the neonatal period. Okay, from day 0 to up to 5 years, it's under 5 years. Then from day 0 to 1 year is the infant. Okay, all these concepts are really very important. Then we are going to see what are the formulas for indicators, that is maternal child health indicator care. So we are also going to see targets and assessment of these indicators. First is the infant mortality rate. Infant mortality rate is defined by number of infant deaths occur in total births of a baby. So number of infant deaths upon live births into 1000 is the infant mortality rate. Current infant mortality rate in the 2023 is 28. Okay, then what are the best indicator? Infant mortality rate is the best indicator for overall development of a nation. We can assess the development of nation by just looking at the infant mortality rate of that particular nation. Then infant mortality rate. Most common cause of infant mortality rate is the low birth weight and prematurity. Okay, the common causes of infant mortality rate, we take this from SRS. So SRS is actually sample registration system, and it is actually developed by RGI, that is Registrar General of India. It actually provides reliable estimate of birth rate, death rate and infant mortality rate at national and state levels in India. It is a dual record system, and it started from 1969 to 1970. Actually, it based on pilot basis, and it's very helpful for monitoring fertility and mortality indicators in India. Then second formula we are going to see of neonatal mortality rate. Actually, we see neonate is the from day 0 to day 28. Neonatal mortality rate is the number of neonatal deaths upon live births into 1000. So current neonatal mortality rate in the year 2023 is 20, and target by 2030 as per sustainable development goals are less than 12 per 1000 live births. This is the target. You have to remember, this is the way. It's very important actually. Most common cause of neonatal mortality rate is low birth weight and prematurity, as same as like a infant mortality rate. Neonatal mortality rate cause is also same. Again, it's given by sample registration system. Okay, Then third is the stillbirth rate. Stillbirth rate actually from 28 weeks of gestation to day 0, we are calling it as stillbirth. Stillbirth rate is a number of stillbirths upon total births. That is live plus stillbirth into 1000. This is the formula. You have to remember this. Then stillbirth rate, okay, these are also defined as when weight of baby is less than 1000 gram or ground rump length is more than 35 centimeter. You are going to see more details of ground rump length in gynecology section. So okay, current stillbirth rate in the year 2023 is a 5. Most common cause of stillbirth rate are placental causes. Example, antepartum hemorrhage, that is hemorrhage occurring before delivery of baby. Then perinatal mortality rate. Perinatal mortality rate formula is number of stillbirths plus early neonatal deaths up to 7 day 7 into upon total births into 1000. So what is the perinatal period? Perinatal period from 28 weeks of gestation to day 7. Okay. So perinatal mortality rate, best indicator for availability of health services in that particular nation, and the most common cause of perinatal mortality rate is maternal and fetal causes. Then fifth number formula we are going to see are the under 5 mortality rate, also known as child mortality rate. Number of under 5 deaths divided by live births into 1000. This is the formula. So current under 5 mortality rate in the year 2023 is the 32, and target as per sustainable development goal by 2030 is the less than 25 per 1000 live births. This is the target. So under 5 mortality rate is the best indicator for overall development of nation as per UN. Okay, most common cause of under 5 mortality rate is a low birth weight and prematurity. Okay, fine. Then 6 number formula is maternal mortality ratio. Maternal mortality rate and maternal mortality ratio are two different things. So formula for this is the number of maternal deaths upon live births into 1 lakh. Then current maternal mortality rate is the 97. Target by 2030 as per sustainable development goal is less than 70 of 1 lakh maternal live births, that is less than 70 mothers of 1 lakh live births. Okay, best indicator it is the maternal mortality rate is the best indicator for quality of delivery services in that particular nation or in that particular area. So most common cause of maternal mortality rate by SRS 2022 is the postpartum hemorrhage. Direct causes have always more importance than indirect causes, that is anemia. Okay, then we are just look at into more depth in this topic, maternal death. Definition of it's very important. Death of a female due to pregnancy or related causes within 42 days of delivery, not including accident, trauma and electrocution. This is known as maternal death. Causes There are two types of causes, direct and indirect. Direct including postpartum hemorrhage, that is precipitated during labor, hypertensive disorder, sepsis, obstructed labor, ectopic pregnancy, embolism, and abortions. Then indirect causes pre-existing medical condition, that is anemia, malaria, heart diseases. Sustainable Development Goals by the year of 2015 to 2030. We are going to these are very important actually. You just have to remember 2 points, that is Sustainable Development Goals are formulated by UN, and there are total 17 goals. In that, goal number 3 is related to healthcare. Just this much information is sufficient. Okay, then other indicators that is used to assess mother and child health. So first is the maternal mortality rate, number of maternal deaths upon number of female in reproductive age, that is in 15 to 49 years into 1 lakh. I told you difference between maternal mortality rate and ratio is very important. Maternal mortality ratio is the number of maternal deaths upon live births into 1 lakh, and here number of female in reproductive age. You have to remember this, very important. Then lifetime maternal risk of maternal death assuming maternal mortality rate, and formula for this are 1 minus maternal mortality rate upon 1 lakh. You just have to remember this. Okay, then child death rate, number of deaths between 1 year to 4 years, that is completed 4 years completed, divided by total number of children between 1 to 4 years in a year. So in that particular year into 1000, most common causes are septicemia, pneumonia is actually cause of death, most common cause of death. Diarrhea is actually most common cause of infection. This is death and this is infection. Then accidents and malaria. Okay, then child survival rate, child survival index is a formula for this, that is 1000 minus under 5 mortality rate divided by 10. You have to remember the formula, very important. Okay, evaluation of cause of death in mother and child. We are going to see this topic now. So medical certificate cause of death, MCCD 2021, these actually give information that most common cause of infant mortality rate, neonatal mortality rate, and under 5 mortality rate are hypoxia and birth asphyxia. So these are the most common causes. Then verbal autopsy, it is done to find out the cause of maternal deaths, if not hospital death, by healthcare workers. Okay, and it's done in an field area. Actually, verbal autopsy was conducted at community level, typically in the village and home where death occur, not in a hospital or clinic, to know what is the actual cause of maternal death. So this method used to find out cause of death when no medical certification available, that is in a rural area, to find out actual cause of death. And this is RHME, very important, representative routine restructured household interview for mortality and its evaluation. Okay, so it's done to evaluate the cause of maternal deaths. You have to remember this. Thank you for listening.